Do you ever wonder how treatments for medical issues are developed? Well, you may be interested to know that we have a major research center right here in Phoenix, and they could use your help. This is Dr. Joseph Gimbel of Arizona Research Center with all the details. We've been talking all morning. This is such a cutting-edge center. What do you guys do?
Well, Arizona Research Center was started 20 years ago, and we currently have a staff of 50. We have 3 full-time principal investigators, a neurologist, an internist, and myself, an orthopedic surgeon, all board certified. We've done close to 1,000 clinical trials. We've written 80 articles in medical journals, and we're really one of the premier research sites in the country.
And you're the head of that. I mean, you go in there and you vet these clinical trials, because nothing comes in unless you give it the okay.
That is true.
So I want to talk to you about some of the trials that you're currently studying.
Right. Well, really, there are 4 stages of clinical trials, and we do all 4. But what do you think it costs to get a drug approved today?
Oh gosh, several million.
$2.5 billion on the average.
I was way low.
Right, with a B. I mean,
Wow.
it's unconscionable, but that's the process. And it takes 10 to 15 years to get a drug approved, and only 1 out of 3 on the average gets approved. So the cost to getting a drug to market is astronomical. It really is.
Right, and if it's only, you said 1 every 10 years is approved,
No,
then
10 to 15 years to get it approved.
To get it approved.
1 out of 3 gets approved.
Wow, so you're spending a lot of money, and it may not even make it make it to market.
I'm not, but the pharmaceutical companies are. Yeah.
They certainly are. So I want to talk about those trials. What are you looking for? What do you use that research? How are you coming up with the findings, and how long does a trial take?
Well, trials will vary depending on what we're testing, but we on average do anywhere between 25 and 40 trials. Like now, we're doing a bunion trial, and we've done several of them, and a hernia trial we're going to start, so patients can have their bunions treated free at no cost to them, and be compensated to participate in the trial, as well as have their hernias repaired by a board-certified physician at no cost to them. So we offer this to the community. So for patients that have no insurance or large deductibles, or who are interested in participating in clinical research, this is really an opportunity for them to have their surgeries done at no cost.
And they're paid?
And they're paid, and this is a part of the process of getting the drug approved.
So who qualifies?
Well, you would have to call and go through the questionnaire to see if you qualify, because each study is different with different qualifications. Like, we're going to do probably 6 different bunion trials between now and the end of the year, and we'll need probably another 300 or 400 patients for these trials. So there's ample opportunity to qualify for these
Right, and
trials.
you guys handle the accommodations and all of that. And I know you're working on a big study with opioid abuse.
The opioid epidemic is really, that's all you've read about in the paper. Interestingly enough, last night I was just online and got something in the mail, and there were 2 articles, one from Paradise Valley called "Facing the Reality, Coming to Terms with the Local Opioid Epidemic." In the past year, 790 people have died in Arizona from opioid abuse, and close to 50,000 in this country have died from an opioid abuse. What is really wonderful is last October, the governor and the legislature passed the ability now for patients to get a drug without a prescription called Narcan that will actually reverse patients that are overdosed.
And you're testing that right now?
Well, no, but anybody can get it from the pharmacy, go and get it without a prescription. So if you have a significant other or a child or a friend who's involved with opioids, this is something you really need to have around.
These are game-changing trials.
Absolutely. We're also, interesting, the big emphasis now is on finding alternatives to opioids.
All right.
And again, Bloomberg.com last night had an article, drug makers are racing to find alternatives to opioids.
Well, this is a fascinating research. You could talk a long time about this, and I know you guys are at the cutting edge of all of this, and we appreciate you joining us. But if you are interested in participating in one of these clinical studies that you heard about with Arizona Research Center, they are located at 2525 West Greenway Road, Suite 114 in Phoenix. Give them a call, 602-773-3040, or visit them online, azresearchcenter.com.